Thank you very much. Thank you for joining us today. We are really happy to have you here. I am personally very excited to hear more about the paper that you recently published, and I'm sure all people from our community would like to hear more about it as well. So I think it's the time to start, and we are here today to discuss two things during this PANCO Live. But let me first quickly introduce myself and my colleagues and our dear guests before we start. So this PANCO Live is a meeting that we organize each month to bring our community together and to discuss the most important topics with our members and to discuss and sit together as a community. So we are very happy that you are here. And today's topic is our course that has been recently launched, and our guest to launch the course together with us is Dr. Xiao Gu. So I'm very happy to give the floor to our author in a second to introduce himself. But first, Sumati, would you like to introduce yourself first?
Yes, thank you. I'm Sumati Bajaj. I'm the Nutrition Knowledge Specialist at International. And I was involved in creating this course, and I'm very happy to have Zhao here. He has worked a lot on the topic of healthy diets. And over to you, Zhao, to introduce yourself, and then we can take it forward.
Thanks, Sumati. But before everything, I can't see your face. Is that only on my side or um?
Just my face or both our faces?
Yeah, both your faces. I could only see my own face.
Yeah, so you should be able to see us, and Sumati is also invited guest, and Sumati can see us both, right? So I think it might be on your side.
Yeah, probably it's because my side. But anyway, let me start introducing myself. I'm Xiao Gu, and I am a postdoctoral research fellow at Harvard T.H School of Public Health in the nutrition department, and I got my PhD in nutritional epidemiology from Harvard. In the past 3 years, I have been working with Sumati and a lot of experts and talents in the E-Lancet Commission. So this is a commission that introduced the Planetary Health Diet, which was called the E-Lancet Reference Diet. It's the recommendation to help the world to achieve a healthy and sustainable diet by 2050. Yeah, this is my background, and I'm so glad to be here to discuss the Planetary Health Diet and also one of my papers with the participants here.
Thank you very much. That was a really lovely introduction. So as you can see, we have both like very high quality scientists working on the planetary health diet, and we also have our course launched on PANCO on the planetary health diet and nutrition. So please feel free to ask your questions, because there are no better experts to ask the questions related to planetary health diets than Sumati and Zhao. And Sumati, maybe before we start and before we deep dive into Zhao publications, maybe if you could give us a little bit of a taste of what's inside our Planetary Health Diet course, what we should expect from this course and how it was prepared on your side.
Thank you. To start with, I love that we keep referring to it as the Planetary Health Diet, because the PhD is a big and central part of the course. So it does come out as the essence, and that is one of the reasons why we have Zhao, who was part of the E-Lancet, presenting here. The course is Nutrition and Planetary Health. And whenever we hear about these keywords, the first thing that comes to mind is the Planetary Health Diet. So spot on. Thank you, Elvira, for that introduction. We have developed this course, which talks about healthy diets, sustainable diets, food systems, and finally bringing all of the evidence together for health professionals to see how it can be implemented in clinical practice for patients, for population dietary guidance, and also for your individual dietary choices. So this is a text-based course as of now. We are building videos and we will be having video-based updates as well as a multi-platform course. Right now, the course is for about 11 hours of core learning, and we also provide recommended reading in each lesson. So that's 5 modules with 10 lessons, and the modules span from first setting the stage for why diet is important and how diet is leading the disease burden and mortality in the world, giving new evidence updates. We then move on to talk about what the evidence says on what kind of foods provide what health outcomes. So a lot of the data in that lesson is from epidemiological studies. Xiao has been closely working on such studies, and that's why I'm very excited to have Xiao and learn from him, because we have heavily cited a lot of his papers and his group's papers at Harvard. We then go on to talk about what diets look like. We do have the evidence on food groups, and health outcomes. At the end of the day, diet matters and not just individual foods. So there are then lessons on different dietary patterns. But when you go through those lessons, you'll realize that there's one common feature, that it's rich in a variety of plant foods. We then talk about the planetary health, just looking at what planetary boundaries are. And some of these keywords can be little technical and sometimes also very new for health professionals. So we do have details, very easy to understand details on planetary health, planetary boundaries, and just a basic understanding, plus a more analytical, critical thinking on what the current environmental status is, or how environmental degradation is going on, and how food systems is one of the leading drivers of these environmental degradation. We then again come back to diets and how the evidence talks about what diets and food groups, what their environmental impact is. And finally, we look at the dietary health impact and environmental impact together to see what a healthy and sustainable diet is. And when we talk about healthy and sustainable diets, the first diet that comes to mind, which was exactly designed, and there's been a lot of studies on it, is the Planetary Health Diet. Again, coming back to Xiao, that's where he'll also be presenting on what the data says about the Planetary Health Diet and adherence. Finally, we then have a module on implementation for healthcare professionals, because our main audience here is healthcare professionals. So you'll have practical tips, you'll have exercises, and throughout the course, you have lessons. So it is exciting. And I will now give it forward to Xiao to talk more about his paper. But Elvira, I'll let you introduce Xiao's talk.
Of course. So just a reminder for our community, please feel free to put your questions in the chat. So we are here for you, and our amazing experts are here for you today. So if you would like to ask anything with regards to the topic, the course, or the publication, just let us know over there. So thank you, Sumati, for making the topic of planetary health diet closer to us, for explaining a little bit of what's inside the course. That was very helpful, but the concept itself is one thing, I'd say, but the adherence to this planetary health diet is something different. And at this point, I would like to introduce the publication that Dr. Xiao published together with Professor Willett not so long ago, which is titled Global Adherence to a Healthy and Sustainable Diet and Potential Reduction in Premature Death. So I assume that we were hear a lot about what are the problems or challenges, or how we can measure adherence to diet from the scientific perspective. but also the influence of this type of diet on the premature deaths. So that's really exciting to hear. And what I love the most about these type of meetings, that we will see raw data, we will hear from the people who created it. So that's like a really unique opportunity, and I'm really glad to have you here. So I will send you all the link to the publication if you would like to read it fully. But now, Xiao, the floor is yours. Please feel free to share your screen if you need to and walk us through the publication.
Sure. Let me share my screen. Can you see my screen? I mean, the full screen.
Yes. All good.
Great. All right. So good morning, good afternoon, and maybe good evening. I know this is an international cohort. As I just said, my name is Xiao Gu, and I am a postdoctoral research fellow working with Dr. Walter Willett. I am so glad to be here to discuss the planetary health diet. So today's presentation will include both an introduction of my paper, and also I will cover a little bit about the planetary health diet just as an introduction. And Sumati and I have been working together for the E-Lancet Commission in the past 3 years, and it was an incredible and mind-changing journey. The commission really created a unique opportunity that bring experts in different fields together to produce a report that is fully science and evidence-based. So the paper I will present soon is one piece of evidence that supports the recommendations the E-Lancet Commission made. So before diving deep into the paper, I want to highlight the challenges the current global population are currently facing. We see that food is driving hunger, malnutrition, obesity, and at the same time, there is a dramatic surge in non-communicable diseases ranging from cancer and diabetes to cardiovascular diseases. There are more than 820 million people remain undernourished, and more than 2 billion people are micronutrient deficient. But at the same time, 2.1 billion adults are overweight or obese. And unhealthy diet contribute to all of these, and they pose a greater risk to global burden of disease than alcohol, tobacco, and unsafe sex combined. This is a huge challenge, but it also presents an opportunity. So by improving our diet, we can significantly improve public health and relieve those burdens. So here comes the goal of the E-Lancet Commission. We want to find a way to feed a projected global population of 10 billion people by 2050 with a diet that is both healthy and sustainable. By saying healthy, we want to address both the chronic disease burdens and conditions and also other conditions like undernourishment. And by saying sustainable, we want the production to have less harm to the environment, to be more efficient, and so that can indirectly address health-related issues such as food insecurity. Here's a visualization of the planetary health diet, and anyone following healthy dietary pattern might find it familiar. It is a dietary pattern with an abundance of vegetables and fruits. It's kind of vegetables and fruits are kind of filling half of your plate. It includes plenty of whole grains, nuts, and legumes, and also a moderate amount of animal source foods. It also emphasizes healthy fats like unsaturated plant oils and also limited amounts of added sugar and salt. And on the right side of the screen is the specific daily target intakes, which what makes the planetary health diet unique is the allowed range behind the targets. It's in the parentheses. As I just said, we are not overturning people's current diet, and we are not asking people to be vegetarian. We are actually suggesting a diet with abundant choices. So, for example, if for someone with limited access to dairy products due to either availability or culture, they have the choice to increase their nuts and legumes intake as alternative protein sources. And also, these targets are also not contradicting with many existing healthy diets. It's actually compatible with them and many traditional diets already being consumed in the world. One good example is the Mediterranean diet, and it can be viewed as a type of planetary health diet. Since the publication of the E-Lancet report, many studies have been investigated the association between the planetary health diet and different disease endpoints to see if the diet is really beneficial. So the first E-Lancet report was published in 2019. It has already been 7 years. The table here is for the association between the planetary health diet and the cardiovascular diseases. And this study was conducted in the UK Biobank, and they included more than 100,000 adults from the UK. And we can see that people with better adherence to the planetary health diet have 20% lower risk of total CVD. And the strong inverse association was also observed for other CVD endpoints like ischemic heart disease, atrial fibrillation, and also heart failure. The table at the top is from another observational study in Sweden, and the results, the main finding is the same. The planetary health diet is protective against CVD. And besides Europe, that was also observed in Iranian population, and the association is even stronger. This is also about CVD, and here's another important outcome, type 2 diabetes, and the dose-response relationship is pretty linear between planetary health diet intake and type 2 diabetes risk. And higher adherence is associated with significantly lower risk of type 2 diabetes. And this has been observed in Swedish adults, as shown here, and also in Danish, in Mexican women, and other cohorts with ethnically diverse populations. This is a result of cancer, and also people found it's protective against different types of cancer, like colorectal cancer and prostate cancer, and also breast cancer. We have been talking about the adherence to the planetary health diet, but the planetary health diet is a diet with more than 10 components. So when doing analysis, we always need something to quantify the adherence. That's why we need to develop a dietary score that summarizes the adherence to the diet. Interestingly, multiple E-Lancet dietary scores have been developed in the past 3 or 5 years, and some of them use the binary or 3-level scores for food groups. That could lead to a narrow range of possible scores, and a narrow range could limit its ability to divide or discriminate people's adherence. And some other studies prefer to use a continuous scoring with a wider range. So the Planetary Health Diet Index I'm showing here is one of those that strictly follow the Planetary Health Diet targets and also recommendations from our report. It includes like 15 components, and each component score is actually ranges from 0 to 10 points, or 0 to 5. This figure is from an analysis in the Nurses' Health Study and Health Professional Follow-up Study, and they evaluated the association between the planetary health diet and the mortality based on the PHDI I just introduced. Because of the wider range, the authors are able to analyze the score in deciles. And we can see that comparing to people with the lowest adherence on the left, people with the highest adherence to the planetary health diet had 28% lower risk of mortality. This is the first part of my analysis, showing the global adherence to the planetary health diet using global dietary data in 2018. The global mean PHDI score was 85 out of a perfect score of 140. So if you calculate it as a percentage, it's only like 60% of the ideal scenario. we can further evaluate each component here. But remember that the higher the scores, the better the adherence to the PhD targets. If we take the global average, dairy foods, added sugar, eggs, and poultry receive higher scores, but added unsaturated fats, nuts and legumes, and also nuts and seeds, and other things like soybeans and soy foods, they were the food groups with the lowest scores, which means we have to improve on these parts of our diets. We can also look at the Planetary Health Diet Index by income regions. And interestingly, low middle income countries had the highest score, but low income countries and also high income countries, they are scored lower. This higher score in low middle income countries is largely due to high intakes of whole grains, relatively low intakes of all animal protein sources, and also low intake of added sugar. And here on the horizontal scale, we can I'm presenting the component scores, and so the columns here are showing different regions by income and also geographic regions. As a contrast, while low-income countries have low intakes of most animal protein sources, they also have a limited consumption of added unsaturated fat and healthy plant-based foods such as non-starchy vegetables, whole fruits, nuts and seeds, and also non-soy legumes. The intake of unhealthy foods like starchy vegetables and added saturated fats tend to be high. That's why they have the lowest score. The component scores for whole grains, nuts and seeds, and also non-soy legumes were low in both high-income countries and upper middle-income countries, and those indicate lower intakes. The low PHDI for high-income countries was also due to their higher consumption of red and processed meat, and also poultry, and also added saturated fat and added sugar. Along with a low consumption of non-starchy vegetables and also whole fruits. I also plotted the Planetary Health Diet Index on the global map. We have scores for each countries, and this map illustrates areas that did well and areas need more improvements. Basically, the yellowish or red colored countries are below the global average, and the green countries are above the global average. So countries around the Mediterranean Sea, including countries in North Africa, are mostly green, and East Asia and Southeastern Asia are also good. But countries in South America have particularly low PHDI, and North America also didn't do well. We also want to know what benefit will the planetary health diet bring us. And we want to know how many premature deaths can we prevent if we really ask the global population to adopt the PhD. So there's a traditional measure in epidemiology called the population attributable fraction. It can be interpreted as the proportion of prevented mortality cases in the population that can be attributed to the improvements in the planetary health diet index from the current level, as I just showed you, is 85, is a score of 85, to a higher reference level. We can now be thinking, what if the global average can be improved to 140 or any other higher numbers? So we calculated the population attributable fraction, and our results show that even if the global average PHDI can be increased to 120 instead of 140, we could prevent about 15 million premature deaths among adults annually. This represents about 27% of deaths worldwide. The impact also varies across disease categories. The largest reduction could be seen in cardiovascular diseases, approximately 2.5 million deaths due to cardiovascular diseases could be prevented per year. And also respiratory diseases, which are often overlooked in the dietary discussions, could see 2 million fewer deaths per year. And nearly 1.6 million deaths from infectious diseases and also 1.4 million cancer deaths could also be prevented by adopting the planetary health diet. We can also see how many different parts of the world could benefit from improving diet based on the planetary health diet recommendations. And Latin America and also the Caribbean, which currently have some of the lowest PHDI score, they would experience greater benefits, and up to 36% of all deaths in the region could be prevented. Middle East and North Africa, they generally have higher PHDI scores currently, but they still could prevent 18% of their annual deaths by adopting the planetary health diet. The numbers are actually impressive, but they also show that some regions need more support and policy intervention to make healthy diets more accessible. So in conclusion, we can say that the global adherence to the planetary health diet is still far from optimal, and we really have a long way to go. A little bit about the transformation or the way to successfully adopt the planetary health diet. Actually, planetary health diet allows great flexibility. All the components are actually compatible with a wide range of foods or different agricultural systems or cultural traditions and individual dietary preference. That means you can be omnivorous, and you can also be vegetarian. And there has been a misunderstanding that the planetary health diet is a vegetarian diet, but that's not true. People eat differently all over the world. And if you are not a meat eater, you have the option to replace them with healthy plant-based protein sources. And we want to highlight that healthy dietary patterns can be achieved in different contemporary populations. And to show the flexibility and the adaptability of the planetary health diet, we collected photos of the PhD examples around the world. And please know that we assess the nutrient adequacy of all these dishes on the photo and make sure that they are all compatible with the planetary health diet. And actually, Sumati helps with a lot with that. And sometimes you just need to slightly adjust your current recipe, and you can be PhD adhered. So on the photo here, like in the second row is from the left, it's a diet from Mexico. And also we see in the middle is the picture of the example from Senegal. And on the right side is from Brazil. And the third row here, we can see example from China, Brazil, and also Taiwan. And also to facilitate a real food system transformation, we can't just stay on paper. The institution behind the E-Lancet Commission, EAT, they have been connecting and partnering across science, policy, business, and civil societies. And we want to provide a multilateral platform for different communities to share information, to get informed, and to come up with realistic actions to take. That's why we initiated a project called Communities of Actions. And actually, PAN is one of our important communities representing the healthcare professionals. And since early last year, we have been working with 12 different stakeholder groups, and that includes scientists, retailer, and also healthcare professionals, as I mentioned, and also consumers, farmers, and then many more. We opened up conversations within those communities, and more importantly, across these communities. This is an action brief that that Sumati and I also worked with Penn, and actually from, Nani and Roberta from Penn, and we developed this action plan to guide people how to adopt or how to transfer the current food system into the Planetary Health Diet initiative system. And if you are interested in the details of the action plan, or actually action brief, you can scan the barcode here. And here's my presentation, and please let me know if you have any questions.
Thank you very much. Thank you, Xiao, for your presentation, and that was really inspiring. And all the people loving science and number-oriented, like, really had a feast, I guess. Thank you very much. And please, everybody, if you have any questions, just drop them in the chat. This is like an open meeting. We always encourage people to take part in the conversation here. And now I'll give it back to you, Sumati. Sumati, we can't.
Presentation. Can you hear me now?
Oh, yes, now we can hear you.
Thank you, Xiao. This was an excellent presentation. I loved refreshing all the science-based facts that we had during the commission work. And I must say, this was a really nice and very valuable study that you've published. A few questions, and I'm sure there are other people as well, but on the floor, I will take the opportunity to ask the first question. I'll ask my first question that might be a little more technical based on your paper, and my second would be more general. So one, I remember you showed a graph how adherence to the PhD is associated or linked to health outcomes. Is that correct? That was a linear graph. Would that look different for specifically the PhDI? Basically, I want to ask if my score is 25 and if I were to go up to 30 versus if my score was 80 and I go up to 85, would my gains be similar in terms of health outcome?
That's a great question. Like, for example, using type 2 diabetes as an example, so we saw the association is linear. So on the linear scale, which that means if you increase from like 25 to 30, that's like five points increase, and or from 80 to 85, that's also another 5-point increase. The benefit or the reduced risk of type 2 diabetes is the same. But at the same time, we also analyzed those those associations in quintiles and quartiles, and that also support that it's kind of linear. And we did different analysis like cubic spline analysis, and that also showed that it's kind of linear. So whatever your baseline is, any increase in the score or any improvement in the adherence will bring you a lot of benefits. That's for sure. And that's for type 2 diabetes. For cardiovascular diseases, I believe it's also similar, because I think I'm not sure if I showed you those response relationship in my presentation, but multiple studies also show that it's pretty linear.
Okay, that's good to know. And from what you said, I understand that if my diet was poor, I would definitely benefit from improving it. If my diet is already good, I will still benefit considerably by improving it further. So we can only get better. It's not based on marginal improvement. So that's good to know. There is more incentive for everybody to improve their diet.
Oh, yes. Yes, if your diet is already good, then you are the key person to influence the others around you. And but in fact, achieving a Planetary Health Diet Index, or the score of the full score of 140, is still very aspirational. So in my paper, I tested different scenarios whether people increase from 85, the score of 85 to 140, or more conservatively to 120, or even more conservatively to 100, to a score of just 100, which is only 15-point increase. We saw that whatever you improve, there will be plenty of deaths being prevented. So any small step really means a lot.
That's very helpful. My second question is more generic. And I really appreciated how you disaggregated the results by region and income levels. And it was very fascinating to see that the highest PHDI score was for the lower middle income countries. And and it was still different for lower income countries and higher income countries, but very specifically higher for lower middle income countries. Do you think, based on other analysis that you did by food categories, that this is due to economic reasons, or is it more due to the traditional eating patterns and it coincidentally comes up with those income level groups? What do you think is the main driver?
Yeah, I think it's actually impacted by both. So actually, the highest income countries, or the most westernized, I would say westernized countries, they have kind of lower scores, and we know in their diet there are a lot of processed foods, and also a lot of like animal-based protein sources intake. And also because of the development of fast food chains, and there is an increase in unhealthy foods like carbohydrate, and also a lot of refined grains intake. But in upper middle income countries, they are still preserving some of their traditional diets, which focus more on locally sourced foods, which are more fresh and also less processed. That's a key part of the benefit that that can make the Planetary Health Diet more meaningful. But they are also on the way of economical development, and a lot of countries are on their way to be westernized. So actually, that's an issue that the global population should combat. And maybe we can look for more locally sourced foods, and also look back into your traditional diet instead of following what the Western countries they are consuming. Also, for related to that is the low income countries. We show that the score for the lowest income countries are also pretty low. They do have access to their traditional diets, but because of the economical development, they have to like fill their calorie intake or calorie need with more calorie dense foods, which are kind of unhealthy, like refined grains. That's kind of limited by the economical reasons. So that's why we saw that upper middle income countries, they are economically more relieved, but they also they are still preserving kind of their traditional diet, and they have access to a wide range of very diverse foods, and their food system is kind of more robust currently.
Thank you very much. And actually, speaking about this topic, I have my own question in mind, because, we are a community of healthcare professionals mostly. There are doctors, dietitians, so people very often working closely with patients. And I was wondering, a full diet is a concept, and sometimes changing all your dietary habits is difficult or impossible. So thinking in terms of preventing premature deaths, if you could give like one advice, what would be the most important thing to change in your diet today to prevent this premature deaths, like according to the numbers and all the knowledge you have?
Well, I think, as you said, changing, overturning people's current diet is not possible.
Yeah.
And that means like people, but also that also means that people have different baselines. Like a lot of people, for most of the people, they only need to change part of their diet. Like for a lot of meat eaters, they eat tons of red meat, and also like burgers, things like also from fast foods. For them, my advice is just to slight reduce as much as you can in terms of red meat intake or processed food intake. I think that will already increase their PHDI score a lot, because PHDI, the scoring mechanism, it actually penalizes people for eating those foods. And actually, by saying penalized, it's also related to the evidence that these foods are strongly related to higher risk of different diseases. So, I mean, shifting only part of the components already reduce your risk. But if you can really change more part of the diet, like increase more like soy food intake or other alternative plant-based protein source food intake, that will be even better. But as I said, the planetary health diets, it's already embedded in a lot of traditional diets, like those in the Mediterranean countries. And also we saw that they are kind of in like a lot of Asian diets. And what I showed you, the pictures, they are from different local diets. And like only changing your recipe a little bit can make your local foods or your traditional diets adhering to the planetary health diet. And I think Sumati also helped a lot of that about the nutrient adequacy analysis. Sumati, do you have any thoughts on that? You help us with the planetary health diet examples.
Yes, when we did the nutritional analysis, it did come out to be nutritionally adequate. I mean, the diet is mostly about how you constitute your meal and not so much about individual foods. So you need that diversity to meet your nutritional needs. And that has also been highlighted in the report. And it was nice to see it in real life meal plan.
Yeah.
Yeah, exactly. And speaking about international audiences, because we are international here as we sit together, I remember the example that Sumati once gave, and that was really inspiring for me to hear that, for example, for people in India, the change is not to decrease their meat consumption because their diet is often vegetarian already. Their problem is ultra-processed food, for example, or this unhealthy cooking techniques. So it also depends on where you are, but I completely agree. Like you could make a small changes in your recipe or changes with one product consumption, and that could make a real change. And I think that's what we saw from your data, right? And that was really great piece of evidence to support all we are saying all the time, like, or we are advocating for. So I just wanted to say, like, to people here, like, the things that we are saying and promoting nutrition is crucial, and you could see the data for it. So just to say, and that we are all aware of that. And Xiao, that was really great presentation, but I wanted to ask you, like, for the very last final conclusion regarding the paper that you shared with us today, but also having in mind that we have this healthcare professional community here with us. What would you like to tell them?
I will say that as we discussed before with Sumati and also the other members or maybe the participants of other members of the Physicians Association of, I forgot the full name.
Yeah, that was great. That was great. Physician Association for Nutrition.
Yeah, we had a lot of dialogues in the past year. We talked a lot about how the healthcare professionals can influence people around them, and also how they can influence like policymakers and other stakeholder groups. Actually, the healthcare professionals are really powerful. They are kind of the authorities that can giving people recommendations. So I would say the first step is that for healthcare professionals, you can try adopting the diet yourself first, and see if it's easy to change your diet, or if you are experiencing any challenges. And we actually give a lot of solution from the E-Lancet Commission report, and in how to transform your diet. And also the action brief I just mentioned. There's the QR code there. You can check that. It's kind of a summary. And I mean, it's better to start with healthcare professionals themselves, and then you can give advice to your patients, or other people or other colleagues around you. And another thing is, you can kind of be a voice to convince the policymakers, or convince your institutions, like your hospitals. Maybe you can change your the meal provided by your hospitals or by your institutions, make them more plant-based, or reduce a little bit about the processed food and animal-based proteins in the meal provided to the healthcare professionals, and also to the patients of the institutions. And that's already a lot of impact.
Thank you. I think
Sumati, do you have other
we
to add?
couldn't agree more.
No, you covered it all.
Lovely.
Yeah, but I really recommend people to read the action brief that we drafted together with PAN.
That's a good conclusion. Just read the report and bring it to life, bring it to your practice. And to everybody with us here, I'm very happy to share the QR code from you, Xiao, to the report, or share any relevant materials if necessary. We will share it on PANCO, so stay with us here, and we'll make sure to make it accessible to you. And thank you very much. Thank you for highlighting the importance of healthcare professionals in the battle that we have around nutrition. This is really important battle, and we are happy that we could work on it with you. And Xiao, you presented the data, then we discussed how important it is to take care of your diet to promote healthy nutrition. And we should also give our healthcare professionals, doctors, medical students, and other healthcare professionals the tools to work with patients on nutrition, because that's not an easy thing. So here it is. We have our course on PANCO. And Sumati, the closing line from you, what do you recommend? How to go further with the course? And of course, having in mind that we are all very busy people. We are tired, we are busy, we work with patients a lot. So this can be challenging, but this is really important. So Sumati, just give it back to you, what you can tell us or encourage us with the course that you just launched.
Thank you. I think it's a very nice way to tie it back from our last question, central to changing diets, to changing food systems, and advancing even planetary health and environmental change. And this is why the course is here. And the course is free. The course is advanced, yes, yet foundational. You have a lot of evidence-based analytical thinking, but also explained in very easy terms. You have engaging questions. You have quizzes to go through. You will not be bored. You have further reading as well. So just if I were to say it very quickly, I would say it would be very useful to go through the course. And of course, there are ways to also then reach out to people, to reach out to experts who've written those further readings. You then use the final module to implement it within your clinical practice. And again, coming back to how health take this forward. Courses are one way to do it. There are many other ways as well, but I would start with the course. And the course is free, and we do have an opportunity for you to obtain the certificate as well. Would you like to briefly explain about that, Elvira?
Yes, of course. So I'm very happy that we created something that could help us bring the knowledge into practice. So sometimes reading a publication is just the first step towards implementing the knowledge that you just learned, or maybe understanding it better and deeper. And I also always say that the biggest advantage of being on PANCO is the access to your colleagues and people who are in the same situation, facing same challenges. So you have always the opportunity to ask. You could ask Sumati, where she was the author of this course, but you could also engage with the colleagues over there, so you could think together how to improve this nutritional approach with your patients. So this is like one of the biggest advantage. And I've already shared the link to the course with you, so feel free to explore it, sign up for it, and move lesson by lesson. And at the end of this course, we kindly ask you to share your feedback. So we would really like to hear from you. How did you like the course? Did you enjoy the experience? And what we can do better in the future? So this is really important part for us. Also, we prepared a certificate for you. So we understand that updating your knowledge and the lifelong learning journey is like part of being a medical professional very often. So that's why we prepared a professional certificate that you could obtain in the last lesson of the course. So when the course is done, when you completed all the lessons and everything is absorbed, then you can have their certificates if that's needed for your career journey or just sharing your success on social media. In the meantime, we are here for you. We are on PANCO. The network is live 24 hours. We are experts from all around the world. So please engage with each other, ask your questions, and stay active so we could all learn, and learn by doing, actually. So thank you very much, Xiao. The presentation was absolutely amazing. Thank you very much, Sumati, for preparing the course, for launching it today with us. I think that will be of a great benefit to our entire community. And I hope I'll see you next month for another PANCO Live.
Thank
Thanks,
you.
Elvira. Thank you, Xiao, again.
Thank you,
Thank you
Sumati.
so much.
Thank you.
And all the best for your future plans. Thank you, everyone. I hope you enjoyed and have a nice day. Bye-bye.
Bye. Thank you.
Thank you very much. Thank you for joining us today.